Okay, so exactly that is about medical statistics. And this statistician have said like this: in God we trust, all others bring data. W. Edward Deming is a very famous statistician, and he designed some quality control procedure in Japan. So after the Second World War, and he came to Japan and help the industries in Japan to develop a series of quality control procedure, just like Six Sigma principle, like that. So you can find the experience of this statistician. Okay, so generally speaking, the resources of data come from two ways. Firstly, will be the not so specified research. I mean, the data come from some daily medical job, just like outpatients. You can collect the information from the outpatient clinics, or you can get some information from the just like health service providers. And also you can you can check my slides. I copy some resources of data from like population surveys. And you know, recently in China, we are going to have a census. Formally begin from November 1st November, and so you can check some information. So that is I think it's I'm not sure, it's the seventh census in China. Yeah, after the new China building. Yeah, I think it's very formal, and from the governmental aspect. So that in census we will collect the some demographic information of the Chinese, all Chinese. Yeah. So that is population survey. And yeah, we can collect the information from the health service provider, just like from physicians, from hospitals, from some nursing homes, like that. And also, I think in almost all of the countries have some structures or department about the vital statistics. That means the birth, death, marriage, divorces, all of the events will be collected. So that is the vital statistics. Okay, so I think you can search in internet and to collect the information from your countries. Yeah, just like I think the measures about birth, death, marriages, divorces, or honor, maybe health status of the citizens from all of the countries. So so I think it should include your countries. All countries will have that information. and also the data also come from some just like registers of disease. Just like I know in China we have just like a CDC Center of Disease Controlling from all levels. That's from province, from counties, and all collect the information about the disease. And just like some chronic disease, just like a cancer, yeah. And also about the infectious disease, just like AIDS, just like yeah, the recently the terrible infectious disease, and also yeah, incidence, prevalence, and outcomes of this this disease. Yeah, all come from the CDC's jobs. Okay, so I think you can all of you can list the resources of the data from your countries. Yeah, I think generally speaking, we have some. I think we have some similar resources of the data, and but for I think for different countries, maybe you have different special way to collect the information. So yeah, if you can share the different resources from your countries, I will be very glad. Okay. Okay. So, but for us, for designed research, it data from designed research, that is very formal, yeah, formal research. Will include two different ways. The first will be experimental study, and another will be observational study. Generally speaking, yeah, I can pose a question. And would you think about as you think the difference between experimental study and observational study? So just from the word, just so I mean, do you have any intuitive impression about the difference between experimental study and observational study? Who can answer this question? No? No volunteer?
What, Laosha?
Mm-hmm.
Yes, Laosha?
Yeah?
Can you repeat the question, Laosha?
Yeah.
In observational study, just we will observe and write the information, but in experimental study, they will work in groups, like we can change it. But in observational study, maybe we can't change.
Okay, thank you. Great. So for experimental study, the research can arrange, yeah, can arrange some factors, can give some assignment for the patients or for volunteers. But for observational study, research just observe, yeah, and they don't give the just like a design the treatment level like that. Okay, so later I will introduce experimental study, the key points for experimental study, and the basic principles for the experimental study. Yeah, so then you will be more clear about what's the very important characteristic of experimental study. Just like if you carry the study with a human being, we call that trials. Trial, a clinical trial is a clinical trial is an experimental study carried out in hospital like that. So we call that a clinical trial. Yeah. Okay. So Thank you for your answer. Okay, so generally speaking, for the formal study, we have some steps. Yeah, so the first step, design. So the design is a very important component for a study. So that means before the study and before the whole procedure to collect the information, we should have a completely and a formal plan for how to collect the information, collect the data set, and how to deal with the data set, and how to report the result from the design. So that's a very, very formal and comprehensive record for the plan. Okay, so second step, definitely, yeah, we practically completely the experimental or observational study. Okay, then you can get the information. And the last step will be data analysis and result report. So that's a basic procedures for study or research. Okay, so statistics or medical statistics play very important role in design stage, just like in data analysis stage. So that means in the whole procedures of the research, and you have to consider some events or some key point from statistical real point. Yeah, because very large chance of the error making from a poor protocol. Yeah, protocol means the plan. Yeah, plan for the study. So that means you have to design a protocol or before the study, before any study, no matter it's experimental study or observational study. Okay, because we believe fancy statistical method cannot rescue garbage data that have been collected. So when you completely collecting data, and if you find you make some mistake, and in the data collecting procedure, yeah, maybe it's later. It's late, so you cannot rescue the garbage data. Okay, just like this famous statistician said like this. Said like this. To consult, yeah, it's necessary to consult a statistician before the study, before the research. So he said like this. To consult the statistician after the experiment is finished is often like to ask him to conduct a post-mortem examination. So he cannot say he can perhaps say what is the experimental died off. Yeah, so that is very important. So to consult the statistician before the study is started and not finished. Okay, so okay, then what is the experiment? I download a definition about the experiment mean. It's a formal definition from wiki. And here you can find it's an experiment is orderly procedure. Orderly means it's a very intuitive idea to do experimental and try to verify some hypotheses. Yeah, you try, and then this human being improve knowledge by experiment. Yeah, so here it's orderly procedure carried out with the goal of verifying, refuting, or establishing the validity of hypotheses. So you try to improve your knowledge, and also experiments provide insight into cause and effect. That's very important in medical study. And you try to find the relationship between different characteristics of the human being, like cause and effect. That's like we know smoking is hazard to your health. Yeah. So here, cause is in smoking, and the effect we have know the outcome of smoking, mainly from cancer. Yes, cancer mortality, cancer. Related disease. Yeah. So experiments provide insight into cause and effect. So cause and effect is a very typical terms from epidemiology, I think. Yeah. And another word is causality. Yeah. Causality means the relationship between cause and effect, cause and outcome. Okay, so that's very important. So experimental, can find the cause and effect by demonstrating what outcome occurs when a particular factors is manipulated. Okay, the purple words still very important. Just like you answer my question, what's the difference between experimental study and observational study? So for experimental study, we can to manipulate the factor. Okay, just like by clinical trial, you can to find the effectiveness of disease of drug or some surgery pattern, okay, or surgery tool. Okay, so that is a factor. And also in observational study, in fact, smoking still belong to factor. Yeah, it's an exposure factor, but in observation study, you cannot manipulate factor. You just observe the outcome from the factors, just like smoking, yes or no, or different dosage of the drug treatment, like that. Okay, so that's the difference between observational study and experimental study. Just focus on if the researchers can manipulate the factors. Yeah, in experimental, yeah, you can do that, but in observational study, you cannot. You just observe. Okay, so that is experimental study, and in experimental study, a very typical study will come from hospital. So that is clinical trial. So Mm-hmm. Okay. So clinical trial is a very, very typical experimental study. So that's why this class I will introduce experimental study just by introducing clinical trial. And because clinical trial is carried out with human being or patients or some volunteer, dependent on different stage of the clinical trial. So, that will, so that will cause the very, very important characteristic of a clinical trial. That means for clinical trial, we have to consider the benefit and the potential risk for patients or for volunteers. So not different from others experimental study. Just you use animals, you use cells. So that means that you have to emphasize more on the potential risk besides the benefit the patients obtained from the treatment, like that. So so when we talk about the experimental study, we have to consider 3 elements that is listed here. The first will be the, let me check, experimental unit. And in clinical trial, the experimental units will be human beings, like patients, like volunteers. Yeah, so that is the experimental units. So that is the first element for clinical trial. And secondly will be the treatment or control condition. So in fact, that is the factors. Factors maybe include drug, maybe some surgery way, maybe some instruments. Okay, so that is the factors. So here, most typical is treatment or control or investigational treatment or standard treatment. Yeah. So anyway, so we have to compare different conditions. That is the factor. And the third element will be outcome. So okay, so that is 3 elements of experimental study and for clinical trial. And if that's a clinical trial, the experimental units will be a human being. Okay, so and the experimental units will be human being or patients, maybe typically patients. And the factors will be investigational group and control group. And here maybe we treatment, because in clinical trial the control maybe still treatment condition, just different from the treatment. Because sometimes we compare the investigational treatment to placebo, and in some case we compare treatment to standard treatment. Okay, so that is factors, and the outcome will be the information you collect from the patients about the response of patients to the treatment. Just like you collect the information of the blood pressure, or you collect the information about if the treatment result is positive or negative. That means effective or not effective, like that. So outcome, about outcome, that is about how do you collect the information, how do you collect data. So that is 3 elements of experimental study, or exactly clinical trial. The 3 experimental study, elements of clinical trial. Okay. Then I will introduce a history of experimental study, and this example comes from a very old very old experiment that come from 1747, and this gentleman carried out the first formal clinical trial like experimental. Clinical trial like means he carried out the study during human being, and he tried to compare different remedies for scurvy. I think you know what does it mean by scurvy?
Deficiency of vitamin C.
Huh?
Due to deficiency of vitamin C.
So
Loosening of gums, Lausha.
pardon?
Loosening of gums. The teeth become loose.
Okay, thank you. So it's a very old disease, and especially in some, just like this study, this experimental, and in some human being group, and this disease is very popular, and so this study, the name is this, James Lind. James Lind was a surgeon and in this hospital, and so he designed these trials. So he designed 1, 2, 3, 4, 5, 6, and 6 groups, and you can check for each group gives a different treatment on the scurvy, just like a quarter of cider every day, and that's like 25 drops of like this, and the vitriol 3 times a day upon empty stomach, and 1/2 pint of seawater every day. Is terrible, You can find some treatment group, some treatment is terrible, and a mixture of garlic, mustard, and horseradish in a lump, the size of nutmeg. In fact, I don't understand some food. I don't know. And 2 spoonfuls of vinegar 3 times a day. I know vinegar because I come from Shanxi province. My hometown is famous for vinegar. Yeah, and also like this, 2 oranges and 1 lemon every day. And so apart from that, only group 1 cider and showed some effect of its treatment. But it's a pity. The trial results wasn't summarized in that year. Yeah, so that means after 100 years almost, and the result was collected again and was summarized again. Yeah, so unfortunately, but this clinical trial and was taken as the first formal trials and with different and parallels groups. So that means in these trials, comparison, the idea of comparison was used for experiment. Yeah, so and especially in human being. Okay. So and also I have to introduce Ronald Fisher. And for experimental study, and the first formal methodology work come from the design experiments. I think should be published in 1935. Yeah, this is a famous work, famous book. Yeah. Okay, so this is the genius of statistician. Okay, so and in this work, from this work, about the experimental study, we have to follow 3 principles. Yeah, and that is like this. Firstly, comparison. Comparison means you have to compare. You have to compare different groups. Then you can make a conclusion about the effect, about effect of some factor. Okay, so that means when scientists try to find if smoking is a hazard or not, and he compare what? Just like firstly for case control study, he compare lung cancer patient and non-lung cancer patient, the 2 groups, and then compare the smoking history, smoking history for the different groups. And for cohort study, and the scientists compare the smokers and non-smokers, and then he can make a conclusion because he compares the lung cancer mortality from smokers group and the lung cancer mortality from the non-smoke groups. So that is a comparison. Yeah, so that means when you try to test some hypothesis, try to find the cause-effect relationship, you have to compare. That's the first principle. And also in RCT clinical trial, you have to assign the treatment randomly, just like which patient take the investigational drug and which patient take the standard drug or control drug. You have to assign them randomly and not by your personal appearance. You have to do that according to some formal way. The formal way is randomization. And the principle 3, you have to collect enough information. You have to observe the events from enough individuals. So that means if you try to compare smoker and non-smokers, you have to collect enough number of the smokers and non-smokers. If you just compare one smoker and another non-smoker, 1-to-1, if you just compare individuals, the conclusion cannot be trusted. Okay, so you have to collect enough numbers. That's some sample size. So we mean sample size has to be enough or large, large enough. So that is 3 very important principles. Okay, so then I will give some details about the three principles in clinical trial. Okay, so first principle means comparison. So that means you have to, when you do experimental study, you have to set a control groups as reference group. Then you can make some conclusion about effect. That means what does it mean by effect? Effect means if I take this drug, I will get some outcome. If I don't take the drug, I don't get the outcome. So you have to compare the status of taking drug and the status of non-taking drug. So that is controlled mean. So here, try to explain controlled experiment mean. Yeah, a controlled experiment often compares results obtained from experimental samples against control samples, and which are particularly identical to the experimental sample, except for the one aspect and whose effect is being tested. Okay, so that is the controlled experiment. So here explain about the characteristic of control samples or control groups. So that means in the patients from the control group should similar to or same to the patients from experimental samples, and except for they take different treatment level. They take different treatment condition. Okay, so a good example would be a drug trial. So that means we mean new drug trial or new drug clinical trial, because new drug clinical trial is the most typical or most popular clinical trial. Okay, so in new drug clinical trial, the sample or group receiving the drug and would be the experimental group, that is treatment group, and the one receiving the placebo. placebo means it's a negative control. That means maybe it looks like the patients takes very similar, I think like the shape, color, a drug-like, yeah, drug-like capsule, but in fact, no effect component in the drug-like capsule, yeah, because it's just the placebo. Maybe just some maybe just some food component, yeah, not effective component of drug. So that is placebo. Okay, just use same shape and same color to the treatment to the investigational drug. Okay. Or sometimes the control group just regular treatment or standard treatment, or compare a new drug, compare old drug. Yeah, so that is a control group. So new drug clinical trial, maybe we use positive control, maybe use negative control. Okay, so that is controlling the experiment mean. And for clinical trial, we have the very formal name RCT. Yeah, when we talk about RCT, that is randomized controlled trial. Okay. So then I will introduce the details for the 3 principles for clinical trial, and I will introduce how do we carry out a formal clinical trial step by step, but in fact I just focused on the principles. Okay, break time 50, come back.